everyone, welcome to Millennial Psychologist. I'm your host, Dr. Margaret Lee. Today we're gonna take a look at CBT, called the Cognitive Behavioral Therapy. CBT is a therapeutic approach that was developed by Albert Ellis and Aaron Beck, combining the cognitive treatment and behavioral treatment. Today, CBT is one of the most commonly used evidence-based treatment for anxiety, depression, and other psychological concerns. So, how does CBT work? Okay, so generally when we're talking about any psychological concern, there's the trigger, which can also be seen as the situation, the context, something happened that trigger your thoughts. And generally, I like to see it as a way, how do you interpret the situation, right? Your perception of the situation, okay? And then there's another component, which is your body, sensation, or a lot of us call feelings, right? I feel sad, I feel heavy, I feel tired. That led to your action or your behavior. So how does this work? I mean, does that only go one direction? Not really, but generally it goes in this direction. Why does it go back to the trigger? Because sometimes the trigger can start as external trigger and then turn into internal trigger. So give a very concrete example. You tested your friend and your friend hasn't tested you back. One way of interpreting the situation can be like, maybe she's mad at me. Maybe she doesn't like me. Maybe I offended her the last time I talked to her. So using this way of thinking, you feel guilty, you feel angry, how could she do this to me? And maybe you would choose to act in a way to avoid her. So when she texts you back, you're just gonna ignore her, which creates more trigger in the future. And then she's gonna think, maybe she's busy, maybe, she's also in the middle of something and doesn't want to reply. Then over time, we form this self-fulfilling prophecy that, hey, my friend is distancing me. But then let's say if we're able to change the way we interpret the situation. So for example, in this situation, you tested your friend and she hasn't replied your text. And you think to yourself, oh, maybe she's busy. Oh, maybe she has something happen to her. And then you'll be like, oh, okay, I'll just wait when she's done. And then she will text me back. Then it wouldn't trigger the whole cycle of emotion. So this is how CBT works. So CBT treatment usually looking, how do we identify the trigger for you? And what type of thought that come to your mind or the thinking trap? Some of them might be mind reading. You're assuming you know what the intention of the person is. For example, in our last example of your friend, right? You were assuming your friend's intention of not texting you back. And with the thoughts, how do we catch it? And then check it, and then the last step would be to change it. So some of the behavioral intervention we use might be to train your assertiveness. How do we confront certain topic or clarify certain topic with your friend so that there's no misunderstanding in between? And of course, all of this can be a little bit more complex than the 4 components. But these 4 components are the major components of your emotional pattern. So if you're struggling with anger, depression, anxiety, you want to ask yourself what your pattern is based on this diagram. So CBT is not just some skill sets to change how you think or how you behave, but more to help you understand what is making you behave in certain way or think in certain way. Are there any automatic response, not even through our conscious cognition, but just a reaction to certain stimuli? We want to add some response time. We want to add some reasoning. We want to, investigate why we do what we do, how we think what we think, so that we can make the best decision each time. So that's it from me. CBT in a nutshell. I hope you really enjoyed this video and have learned something new from this video. I upload new psychology video every Wednesday. Be sure to hit subscribe, and I'll see you next week, same place, same time. Thank you so much for watching. Take care.